Now, you mentioned that people come up to you all the time and ask you questions about plastic surgery, especially when you're out. You know, you may be at a Mardi Gras ball or a function. How many people have come up to you and say, hey, how can I make my boobs stand up like this without putting tape on them? Say it.
You
People
mean
ask.
how many times am I not asked that question? I can't. There's very few. A lot of things get asked at those events. And while everybody enjoys talking about what they have a passion for, and I have a passion for what I do for a living, you know, it is hard to give somebody exact advice in that situation.
I can only imagine some of the questions you are asked.
You know, another funny thing is that, you know, most of the plastic surgery procedures we do are covered by clothes, yet that people are not afraid to ask whether they need something or how much they need something when they're fully clothed. And it's a little hard to tell unless they're willing to
Strip down naked
in the middle of the party. And I don't think my wife would like it if I took it in the bathroom. So we don't get very far. Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Hi, everyone. Welcome to Plasticos. I am Kym Anderson along with Dr. Christopher Park. And this is our first podcast, and we're going to talk plastic surgery and everything that you've always wanted to know, if you considered it, why you should, anything you want to know. Let's first introduce Dr. Christopher Park. Hello.
Hello, hello.
Let's talk a little bit about you first. How did you get into plastic surgery?
Well, I was in medical school, and there's a variety of specialties I was considering, but when you actually get into plastic surgery and see all the amazing things that we do, we work from head to toe, from newborns to 100-year-olds, and it's just amazing all the things we do.
And you do amazing things. A lot of people think that plastic surgery, that's just enhancement of the body. They don't think about the other aspect. And I've got to say this, I met you about 10 years ago when my son had second and third degree burns on his hands. And at the hospital, they told him he would have no motion. But you worked miracles on his hands, and he was back to playing basketball weeks later. Full range of motion now, and he's in college now, wanting to be a doctor himself.
Yep, I mean, those are the things that help me sleep well at night.
And that is so awesome. Let's talk about exactly where you went to medical school, then we're going to talk a little bit about your family life.
Yeah, so I grew up here in Mobile, but then I wanted to go somewhere else for college, so I went off to University of Virginia, which is an awesome school. After that, I came back to Birmingham, University of Alabama School of Medicine, which is part of UAB. I knew I wanted to do something surgical and explored during that time, and found a very valuable mentor, Louis Vasquez, and I tell him all the time, he's the reason I chose plastic surgery. Once I chose to do plastic surgery, I kind of looked around and was lucky enough to get the program that I wanted, which was at Wake Forest University, which is in North Carolina. It's called an integrated plastic surgery residency. So before that time, most programs, you did general surgery first and then decided what you wanted to do in terms of fellowship. But this was an integrated program where you went straight out of medical school and everything was organized. So plastic surgery covers a huge breadth of topics, and it used to be you had 2 years to learn it after doing general surgery, but this was a 6-year program, so it was much more involved.
So you spent a lot of time in school, which is great because it makes you more knowledgeable.
Correct.
Let's talk a little bit more about your family life now. You're a husband, a father.
I am. I'm very lucky. Met my wife at UVA, so we both love UVA, and she ended up doing medical school as well. She ended up going to UAB as well. She could have gone to LSU for free and still went to UAB medical school to be with me, and that was great. And it was very complicated. I mean, med school, you match in a residency. You really don't get to choose out of a list of 3. The computer ultimately spits out where you go.
Yeah.
So we had to sweat it out. We'd end up the same place, and we did. Had my first daughter there, Ashley, born in North Carolina, and then Alden was born right after we moved here.
So both of you are physicians. How do you manage to balance the work schedule and family life, children?
A good wife. I mean, I'm amazed at what she does. I mean, she only works part-time, not full-time, but she basically is just as present as a stay-at-home mom. It's amazing.
Yeah, a strong woman that makes all the difference in the whole world. People don't realize how much a good wife balances the family. What made you decide to come back home to Mobile?
I mean, Mobile is such a strong draw, not just for me personally, where I have family, but just the environment and the outdoors and the beach and the weather. I don't love cold weather, and it's really been fun.
Oh, I know what you mean. I moved here 12 years ago to Mobile, and I said, I will never be landlocked again. You love the fact that you're right down to the beach and you've got warm weather. Now, at the beginning of this podcast, we called it Plasticos. Let's talk about that. We know it's plastic surgery. Where did you come up with the name Plasticos from?
So plasticos is a Greek word that is the origin of plastic surgery. So plastic surgery sort of started back in World War I. There were only surgeons back then. There weren't specialists. And those surgeons began working more on the reparative, reconstructive side of things. And somebody molded the word from plasticos in Greek to be plastic surgery, meaning those are the surgeons that mold things back towards normal. And the name just kind of gradually stuck. I get asked by very intelligent people, what do y'all use the plastic for? I just don't understand. I really have been asked that question numerous times. And so that's kind of my answer, that it's based on the Greek word plastikos. So I thought that was a great name for the podcast.
It's not plastic. You're just fixing things that need to be fixed.
Correct.
It's amazing.
Molding.
Molding things that need to be molded.
Correct. And that includes everything from cleft lips and burnt hands and to cosmetic.
And making us look beautiful.
That's right.
All right, with our podcast, talking about different plastic surgery, there's so many people who are interested in it, and maybe they don't know whether that's for them or not. So we're going to bring that home. If you're considering it, why it may be for you. I myself had looked at plastic surgery at one time, and that's because I had very large breasts and wanted to reduce them, and I'd done my research, and I came and talked to you about it. So let's talk to people about how we're going to help them.
That is why I'm doing this podcast. I'm very busy, and even though this is an investment in time, it gives me a chance to discuss all the things we're going to discuss in these episodes to the extent that I wish I could discuss all the time. I get these questions obviously in the office, but I get them at parties, I get them walking down the street, and I'm just hoping that it gives me a chance to expand on each topic that we go through and educate people on those questions, because there's so many people that have wanted to do it for 5 years or 10 years or longer, 30 years, and didn't realize how easy it could be, and also they worry about wasting the doctor's time if they don't know if they can afford it or what the recovery's like. Or it is a hot topic and people want to know, but that doesn't mean they're willing to ask. So I'm just hoping that they can easily hear some answers and discuss it.
Now I've run into some people who they're kind of like embarrassed to talk about it. Absolutely. They're saying that, we want to do something, but we don't want people to know. You can enhance yourself and the world doesn't have to know about it.
Absolutely. More than half of my patients, people have no idea they are patients. They did it for themselves. They did it for their family. These are not making you look like your lips are 1,000 times bigger than they're supposed to be. These are normal people making themselves happy.
Now, you're talking about you're very busy, and we know you are as a doctor. You've got a full practice. You're seeing patients continuously throughout the day. But you're taking this time to do this podcast because you want people to know how this can be beneficial to them.
Absolutely. I like to connect with people, and my staff could tell you. If I had my way of it, I'd be in clinic for all night just kind of talking, and you can't. For their sake, my sake, then you start falling behind. And so I'm hoping that people can listen to this either before they see me or after they see me and hear some of what I said again, but then even hopefully hear more. Then they have time to sit there and listen to me face to face.
So let's talk about some of your favorite surgeries that you like to do.
It changes through the years, but right now, kind of my favorite thing to do is, I don't like the term as much, but kind of the mommy makeover is a term that people like to throw around. But the reason I like it is I like getting to address multiple things at once, and not only for their sake, combining recovery, but it just gives you more ability to have that patient see a dramatic change when it's done. You can do one thing at a time, of course, but doing multiple things, once they get over it all, it's just so much more to appreciate.
When you talk about the mommy makeover, because some people may not realize what that is. I'm a mother. I gave birth to 3 children, and we know that things just don't sit right anymore. They head south, and then you've got the tummy flap and everything else.
Like I said, I don't love the term, but the general point is, let's fix the things that being however old, 40, and having children has done. And it usually involves the breasts and the abdomen, but of course there's other things. So most commonly, it's a breast lift with or without implants and a tummy tuck and liposuction in general. There's lots of other things that could come up.
And it gives you a whole new confidence that you really didn't even realize, this makes a big difference.
It does. My practice is not the Hollywood type of dramatic, odd change. We're looking to make people happy with their body again and live a normal life.
All right, well, let's talk about the most rewarding surgeries that you've done.
You do get into the pediatric realm there because you do things that affect people forever. Take cleft lip, for example. These are brilliant, normal, wonderful children that are born with a deformity in the face that back in history, these kids were outcasts. There's nothing wrong with them at all. And a complete cleft lip looks extremely odd. And it can be fixed. And fortunately now we can do a great job at it, and we do it before they're even a year old. And they just go live a normal life. You may have to do some tweaks and revisions as they grow. So that's one of the most unbelievable.
Well, that's pretty interesting. We're going to have to talk more about that on another podcast. Now let's talk about the med spa that you also have in the practice right now.
Not only in my practice, but just nationwide. I mean, there's a trend, even though I love surgery and that's what I'm here to do. I mean, there's a trend to do more and more things less invasive, non-surgical, amazing technologies. I mean, lasers came out a long time ago, but they continue to be enhanced. So the med spa is basically everything in my practice that is non-surgical. It embodies the things that I do outside of surgery that are a treatment. So there's a lot of injectables and lasers and devices and facials and products and all sorts of things. And it's inside the practice.
Pills and anything else that you want that smooth out your skin and keep you young looking.
The beauty of it is the way that it compounds and builds on itself to help a patient, that is either trying to hold off having surgery or never going to have surgery, or you've already done surgery and you want to continue to tweak things.
When you say tweak things or maybe have surgery, people are thinking older people. I bring my 12-year-old daughter to your med spa because you've got this teen facial thing, and she has a problem with acne, and it has helped a lot.
Absolutely. And my daughter goes as well. I mean, she's 13. And that's one thing that I wanted to get going way before we did. I mean, we're not doing that to make money. We're just trying to make people feel better. And if that's your 12-year-old daughter having less acne and being happier going to school, that's just as important.
Build self-confidence.
Absolutely.
And their self-esteem, which helps it a lot. So it's just amazing the different things that plastic surgery can do. And we've got a plethora of surgeries that we're going to talk about in upcoming podcasts, which I'm really excited about because there's so many different things. And it's not just for women. You do men as well.
Absolutely.
Men want to look great too.
Yeah.
Okay, now this first podcast, we introduced you, talked a little bit about plastic surgery, how you got into it. But for people who are listening and they want to reach out and they have some questions that we may not answer for them on the podcast, how are they going to get in touch with you?
Well, we can always see them as a normal patient, of course. So they can call the office, 251-340-6600 for a regular route. We also can be reached out to through our website. There's a couple ways to do that, but the easiest is info@mprsd.com. We're Mobile Plastic Reconstructive Surgery and Dermatology. And people still, I don't think, believe it, but I see and answer almost all of those emails myself. And we even have a virtual consultation on our website. You can upload your photos with a password-protected way to do it. And I look at them and I respond. I mean, I still require a hands-on evaluation to figure out what I really want to do. And I talk with my hands, and that changes everything. But it's very easy to get in touch with us.
All right, you heard it. Very easy, very simple. So if you have any questions, reach out and listen to these podcasts because we are sure going to answer many of your questions.
Yeah, I'm really looking forward to this season, and I really want to thank you for taking your time. I mean, Kym Anderson, you're an amazing local broadcaster and celebrity here in Mobile, and I think it's amazing to have you on the show, and I'm really looking forward to kind of exploring each of these topics in depth and going over them.
All right. Thank you.
Thank you. Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.